Hi, I'm Jonah Comstock, editor-in-chief at pharmaphorum. I'm here at ASCO 2026 in Chicago, and I'm joined by two members of the Daiichi Sankyo team, Ken Keller, the global head of oncology, and Jonah Tsai, head of R&D.
Right. Nice to meet you. Thanks for having us.
Yeah, thank you so much for making the time. So I guess just overall, sort of what's ASCO all about for you guys? You have some abstracts here?
Well, this has been an amazing year for us. So far this year, we've had 4 new approvals, all in breast cancer. And at this meeting, we're showing lots of different data on those 4 new indications with the goal of helping patients live longer, better quality lives. So it's a really exciting time for us.
Anything to add, John?
Yeah, ASCO has been great because not only is it in breast cancer, but we've advanced and heard a lot of great news about lung cancer. And we have a number of studies that we'll be reading out over the next year in the area of lung cancer. So for us, it's paving the path for lung cancer, also celebrating the successes of all the hard work with the indications that we've received.
Great. Yeah, Ken, I know you and I sat down at JPM about 6 months ago, and you were telling me about how you have this strategy that really is going to increase provide care like a treatment therapy options for increasing percentage of the people with breast cancer. So each of those different mutations, each of those subgroups, and you said you're hoping to hit 100%, right?
We're getting closer. We are. So with the 4 indications I mentioned, the first one is called for Destiny Breast 09. It's first-line HER2-positive metastatic breast cancer, and it elevated the standard of care, provides patients with 40 months progression-free survival. Then the next 2 indications are in early-stage breast cancer, where cure is the goal. And here, HER2 was approved for the neoadjuvant setting. And what's remarkable here is 2/3 of those patients achieved a pathological complete response, which is after surgery, there's no evidence of disease. That's the first step towards cure. Then the third indication is in the adjuvant setting. So here, this is after surgery, and then they receive an HER2 or the standard of care. And unfortunately, these patients still have residual disease. And what you're measuring there is something called invasive disease-free survival. At 3 years, HER2's patients achieve 92% invasive disease-free survival. So we actually have moved HER2 into the curative intent setting. And then the last indication we just got a few weeks ago was for our second ADC called Datroway, and that's in triple-negative breast cancer. So at JP Morgan, I said our goal is to help 100% of women with breast cancer. With those studies, today we can help 95%. So we're on our way.
And John, tell me a little bit about what's going on in lung too.
Sure. In the lung space, as I mentioned earlier, we're looking at lung cancer for non-small cell lung cancer. And you've heard some news at this conference or Congress already about non-small cell lung cancer. But we already have 3 advanced phase 3 programs looking at non-small cell lung cancer for both the PD-L1 low and the PD-L1 high patients. So with that opportunity, I think what we'll be able to do is look at what we call first-line non-small cell lung cancer. So it's the first treatment that these patients with non-small cell lung cancer will receive, and those 3 results will be reading out over the next 12 months.
Great. So more data to come.
Absolutely.
John, if I remember correctly, you're fairly new to Daiichi Sankyo. You just joined earlier this year?
That's right. I'm in my role as the head of R&D for 2 months at Daiichi Sankyo.
So how is it going so far, and what have you learned about sort of this company and what makes it special?
Yeah, so first of all, when you come into a company and you join as the head of R&D, what's really exciting about it is that you have a platform that you can work with. And what's more exciting than getting 3 approvals in 5 days, as Ken mentioned earlier. And so we've received 3 approvals, and they're major approvals for breast cancer. So that's really the starting point with the ADC platform that we have with deruxtecan platform. The approach that Daiichi Sankyo has taken is using that, it's an advanced therapy platform, and expanding it into other platforms. And that's really the foundation of what we're doing, looking at other ways of combining the ADCs with other agents, sequencing. We're also looking at other platforms, whether that's multi-specifics, bispecifics, we have targeted protein degradation. So it's really just the foundation of where we start to expand into other different modalities priorities for advancing our studies.
Great. Yeah. With TPD, I actually haven't heard very much about that at this show. And so tell me a little bit about that sort of modality and where it is in your portfolio, in your pipeline.
Yeah, so the targeted protein degradation is still fairly early in our program. We just started the first in human in one of the studies. And as we move forward, you'll be hearing more about TPD. I would say probably in the next 3 years or so. So maybe 3 congresses from now at ASCO, we'll be hearing a lot more about TPD.
You have to work ahead on those kinds of scales, don't you?
Absolutely, absolutely.
So Ken, maybe you can take this one. When you've got something like 3 approvals in how many days? 5 days?
5 days. Yeah.
Obviously that creates marketing commercialization challenges, getting that last mile, getting it out to patients. How has that been for you guys?
Yeah, all this great clinical data means nothing unless you put it into practice. So that's what we're working on right now. I can tell you, when you have new data like this that elevates and changes the standard of care, being a commercial person, it's the best job in the world. I mean, walking into an oncologist and saying, I've got something for you that can help you cure more of your patients potentially. Wow. I mean, that's just a wow moment. So our responsibility is to educate, motivate, even inspire oncologists to take this data and put it into practice for their patients. When we take a step back, when you look at the 3 new indications, we have the ability to now help almost 100,000 more women in the G7. And in HER2, an amazing drug has transformed breast cancer. To date, we've helped 238,000 women. These 3 indications give us the ability to help almost 100,000 more. So we are, quite frankly, this is the best time to be part of Daiichi Sankyo and the best time to be part of the breast cancer community.
Yeah. I mean, this is only maybe my 3rd ASCO, but I already feel like every year more of the papers and abstracts are sort of leaps forward or practice changing. Yeah. And it feels like the pace in oncology is not just fast, but accelerating.
Yeah, I think in science, the understanding of cell biology, all the different modalities that we're talking about from ADCs. By the way, there's like thousands and thousands of ADCs being developed. I mean, we're learning more and more, we're putting it into practice more and more, and every single meeting, we're finding new drugs that will help patients live longer. So, even outside of Daiichi Sankyo, I mean, it's just wonderful to see.
What haven't we talked about yet that you guys are excited about? Any other thoughts, either about what's going on at Daiichi Sankyo or trends or things you've heard at the show?
Yeah, so maybe I'll start and I'll turn it over to Ken. I think as we talked about in HER2 and Daiichi, that's just the starting point for us as we expand into other tumor types and other ADCs in our platform. So we have 2 others and a few others that we're looking at IDXD. So we're looking at small cell lung cancer. And then we also have RDXD looking at other tumor types, GYN cancers. So we're expanding into other tumor types beyond just lung and breast. That's a starting point. And then at this Congress, I think, as Ken said, the impact that we've had for patients in breast cancer is tremendous. We're looking to expand beyond that in lung cancer and looking at combinations of ways that we could do that. So really, I think foundational for how we will approach treatment for both breast and lung cancer.
And the only thing to add is, as exciting as it is today to be part of Daiichi Sankyo, we've got over 20 different registrational trials ongoing right now that read out over the next few years. So I think the future just becomes even bigger and bigger for Daiichi Sankyo, but more importantly, we're going to help lots more patients in the future.
Great. Well, it seems like a good note to end on. Thank you both so much for chatting with me.
Thank you so much.